Welcome, everyone, to the Rooted Will Rising Advocate podcast. I'm your host, Mahogany, and I'm so glad you're tuning in. This is a space where we talk honestly about health issues impacting us, Black women, our families, and our communities. We dive into the real stories, the systemic challenges, and importantly, the pathways toward healing and equity. Today is April 10th, 2025, and we're tackling a really tough but crucial topic, the overdose crisis and how it's impacting some members of our communities, with a specific focus on the experiences and vulnerabilities of Black women. You've probably heard about the opioid epidemic, right? It's been declared a national public health emergency. Since 1999, over 1 million lives have been lost in the U.S. to drug overdoses. In 2022 alone, that number was nearly 108,000 people. That's a staggering loss. And while this crisis started with prescription pills, it's morphed into something driven largely by incredibly potent drugs like illicit fentanyl, often mixed with stimulants like cocaine or meth. But here's the part that doesn't always make the headlines, the part we need to talk about. While this crisis touches everyone, it is hitting Black communities harder and the gap is widening. Between 2019 and 2020, overdose death rates jumped an unbelievable 44% for Black individuals. Compare that to a 22% increase for white individuals in the same time frame. And get this, between 2022 and 2023, the rates kept climbing for Black folks while they actually decreased significantly for white folks. This isn't just a statistic. It's a sign that the systems meant to help are failing us. So today, we're going to unpack this. We'll look at the numbers, but more importantly, we'll explore the why. We'll examine the systemic inequities in healthcare, in the justice system, in our neighborhoods that fuel this crisis for Black women. And crucially, we'll talk about solutions, resilience, and what equitable change looks like. Because these aren't just statistics. There are mothers, sisters, daughters, aunties, friends, and these deaths are preventable. Let's dig into some of the numbers for a moment because they paint a stark picture. In 2023, the overdose death rate for Black non-Hispanic people was 48.9 per 100,000. For white non-Hispanic people, it was 33.1. That gap is significant, and as we just mentioned, it's growing wider. Now, finding data specifically broken down for Black women can be challenging, and that's a problem in itself, something we'll touch on later. But the data we do have is alarming. Consider this. A study in Wisconsin looking at 2018 to 2020 found that overdose death rates for Black women there increased dramatically from about 21 per 100,000 to over 32 per 100,000. For white women in Wisconsin during that same time, the rate increased much more slowly, and it's hitting different age groups. National data from 2020 showed that among women aged 65 to 74, Black women had the highest overdose death rate, 12 per 100,000, significantly higher than white or Hispanic women in that age group. Think about our elders, the matriarchs of our families facing this risk. At the same time, we saw the largest percentage increase in overdose deaths between 2019 and 2020 among young Black people aged 15 to 24, an 86% jump. It's hitting us across the lifespan. There's even research pointing to an increase in intentional overdose deaths, suicides involving overdose among Black women, even while those rates were dropping overall nationally. This hints at the deep intersections of substance use, mental health struggles, and the specific pressures Black women face. And geography matters too. For Black individuals, overdose death rates in 2020 were nearly twice as high in urban counties compared to rural counties. This pattern is much less pronounced for white individuals, suggesting factors like segregated neighborhoods, concentrated poverty, and maybe different drug markets in cities are playing a big role for us. These numbers aren't just figures on a page. They represent real lives and highlight deep systemic fault lines. So the numbers show a clear disparity. The critical question is why? Why are Black communities, and by extension Black women, bearing such a heavy and increasing burden? It's not about individual weakness, it's about systems. Let's break down some key drivers. First, healthcare access and bias. Historically and today, we face more barriers getting health insurance, although Medicaid expansion has helped many Black women gain coverage. But even with insurance, the quality of care is often compromised. Many of us have experienced or heard stories of bias, microaggressions, or just not being listened to by doctors. This breeds mistrust when it comes to substance use treatment. Studies show Black individuals are less likely to be referred to or receive effective treatments like medication-assisted treatment or MAT, even after an overdose. Shockingly, one report found that among Black people who died from overdose, only about 8% had documented evidence of receiving substance use treatment beforehand, despite having similar rates of documented substance use history as white individuals who died. That points to massive system failures in getting us the help we need and deserve. Second, socioeconomic factors, poverty, unstable housing, lack of job opportunities. These aren't just economic issues. They are health issues. They create chronic stress that can contribute to substance use. Research directly links higher income inequality in a county to higher overdose death rates, especially for Black and Hispanic populations. If you're worried about keeping the lights on or feeding your family, navigating treatment becomes incredibly difficult. Lack of transportation, childcare, or stable housing are huge barriers. Third, the criminal justice system. Let's be real. The war on drugs has disproportionately targeted and harmed Black communities for decades. We use drugs at similar rates to other groups, but we are arrested and incarcerated for drug offenses at vastly higher rates. And here's a devastating fact. Incarceration itself is a major risk factor for overdose death upon release. People lose tolerance inside, and access to treatment like MAT is often non-existent during or after incarceration. It disrupts lives, jobs, housing, support systems, creating a cycle that fuels rather than solves the problem. Fourth, trauma, racism, and mental health. Living while Black in America often means navigating constant stress from systemic racism and discrimination. This takes a toll on our mental health, contributing to anxiety, depression, and PTSD. Sometimes substance use becomes a way to cope with that pain, especially when culturally sensitive mental health care is hard to find or trust. We saw this during the COVID-19 pandemic. Increased stress, trauma, and discrimination coincided with that huge spike in overdose deaths in our communities. And finally, lack of culturally competent care. Even when treatment centers exist, are they truly accessible and welcoming to us? Do providers understand our lived experiences? Is there support for things like childcare or transportation? Is trauma addressed? Often the answer is no. Some studies even found higher overdose rates for Black individuals in areas with more treatment programs, suggesting that just having a building isn't enough. The care has to be high quality, respectful, trustworthy, and designed to meet our actual needs. These factors don't exist in isolation. They weave together, creating a web of risk. Now, on top of all these systemic issues, the drugs themselves have become much more dangerous, and this is hitting Black communities hard. The biggest culprit is illicit fentanyl. This synthetic opioid is incredibly potent, way stronger than heroin or morphine. The real danger is that it's often mixed into other drugs without people knowing. It's found in heroin, cocaine, meth, and even fake prescription pills. So someone might think they're using cocaine, but it's laced with fentanyl, leading to an unexpected and often fatal overdose. This contamination means anyone using illicit substances is at risk. We're also seeing a rise in polysubstance use, especially mixing opioids like fentanyl with stimulants like cocaine or meth. National data shows deaths involving stimulants are climbing fast, and most of those deaths also involve fentanyl. Research suggests this trend is disproportionately impacting Black communities. For example, one study in Texas found deaths involving both opioids and cocaine quadrupled among Black Texans between 2010 and 2019, reaching the highest rate of any group. Deaths involving opioids and meth also shot up. This changes things. Strategies focused only on prescription pills or just heroin aren't enough anymore. We need approaches that recognize the reality of fentanyl contamination and the dangers of mixing substances. So we've talked about race, we've touched on gender-specific data, we've looked at systemic issues like poverty and the justice system. How do these all come together specifically for Black women? This is where the idea of intersectionality is so important. Intersectionality just means that our identities, like being Black and being a woman, don't exist separately. They interact and overlap to shape our unique experiences, vulnerabilities, and the barriers we face. Think about it. Black women navigate systemic racism and sexism. We might face specific stigmas around substance use, especially if we're mothers. We often juggle caregiving responsibilities that make attending treatment difficult. We carry the cumulative stress of discrimination, which impacts our mental and physical health. Just look at the devastatingly high rates of pregnancy-related mortality for Black women. The higher overdose rates seen in older Black women, the alarming spike among Black women in Wisconsin, the rise in intentional overdoses. These aren't isolated incidents. They reflect how these intersecting pressures create compounded risks. And when we try to get help, we face compounded barriers, a Black woman dealing with unstable housing, lack of childcare, and mistrust of a healthcare system that hasn't historically treated her well, faces enormous hurdles to accessing and staying in treatment. Standard programs often don't address the specific trauma or the practical life challenges she faces. This is why it's also a huge problem that data often isn't broken down by both race and gender. It makes our specific needs invisible and makes it harder to design programs that actually work for us. We need better data, and we need research that truly centers the lived experiences of Black women. Okay, we've laid out the heavy realities, but we are not a community defined solely by struggle. We are resilient, resourceful, and powerful. So let's shift focus. What can we do? How do we forge pathways to equity and healing? First and foremost, center community and lived experience. Solutions have to come from within our communities. We need to listen to and uplift Black women with lived experience. They are the experts. We need to support the Black-led community organizations already doing this vital work on the ground. They have the trust and understanding that bigger institutions often lack. Second, demand culturally responsive interventions. We need services that actively work to rebuild trust, that incorporate our cultural strengths, that are staffed by people who look like us and understand us. This means integrated care that addresses mental health, trauma, and social needs like housing and job support alongside substance use treatment. Third, we must expand harm reduction services. This is about saving lives right now. Harm reduction accepts that people use drugs and aims to keep them safer. This means making naloxone, Narcan, the overdose reversal drug, widely available everywhere, no questions asked. It means supporting syringe services programs which prevent infections and connect people to care. It means access to fentanyl test strips so people can check their drugs before using them. And it means non-judgmental education about safer use. These tools need to be easy to get, free, and without stigma in our neighborhoods. Fourth, enhance treatment access, quality, and retention. Yes, harm reduction is crucial, but we also need better access to high-quality treatment when people are ready. This means more access to medication-assisted treatment like buprenorphine and methadone, especially in our communities. It means tackling insurance barriers, fighting stigma against MAT, and ensuring treatment is available within the justice system and continues upon release. And critically, it's not just about more treatment slots. It's about better, more supportive, patient-centered, culturally grounded care that helps people stay engaged. Finally, we need policy change for systemic change. This starts with healthcare reform, mandating bias training, diversifying the workforce, ensuring fair funding, and pushing for universal health coverage, including Medicaid expansion everywhere. Next, criminal justice reform, shifting away from punishment towards public health, decriminalizing personal drug possession, investing in diversion programs instead of arrests, ending cash bail, providing treatment in jails, prisons, expunging records, and redirecting funds from policing to community services. Additionally, we have to look at socioeconomic policy, fighting for living wages, affordable housing, stronger social safety nets, and better educational opportunities. Better data, mandating data collection that sees us broken down by race, gender, income, location, so we can track inequities and tailor solutions. This is an urgent call to action. The overdose crisis is stealing lives in our communities at an alarming rate, driven by deep-seated inequities. But ignoring the root causes is not an option. We need an equity-centered response that tackles racism, improves healthcare, reforms the justice system, and invests in our communities. We need policymakers, health systems, community leaders, and each one of us to step up. We need to embrace harm reduction to save lives now. We need to build treatment systems that truly serve Black women. We need to advocate for policies that create real opportunity and justice. The loss of Black women to preventable overdoses is an injustice, but by centering our experiences, demanding equity, supporting each other, and taking action, we can save lives, heal our communities, and build a future where everyone has the chance to thrive. If you or someone you know is struggling with substance use, help is available. You can call the SAMHSA National Helpline at 1-862-HELP 4357. That's 1-800-662-4357. We'll also put resources in the show notes. Thank you for joining me on the Rooted Will Rising Advocate podcast today. Let's continue this conversation. Share this episode, talk about it with your friends and family, and find ways to get involved in advocacy efforts in your community. For more content, subscribe to the podcast, visit our YouTube channel, Mahogany Speaks to You, or visit our website, mahoganyspeakstoyou.com. Until next time, stay strong, stay informed, and keep rising.